Well, welcome everybody. Thank you for joining us at our April 2025 DLIS discussions. For those of you who have joined us for the first time, we have these discussions every month. It's an open discussion. We typically focus on a topic, and today's topic is dementia-friendly library opportunities. We have some community guests with us in the audience. Nicolette Costanza, did I pronounce that right? I don't think I did.
It's Castagna
Castagna.
and Christian is filling in for Amber.
Awesome. Thank you so much for joining us, Christian. And Christian Slater and Amber Ladd, who's he's replacing for right now, is from the Department of Elder Affairs, and Nicolette is from the FSU College of Medicine. So they're here to answer any questions that you may have, or any strategies that you might want to pick their brain about. Both Amber and Nicolette was at our Florida Public Library Directors meeting last December and shared a wonderful presentation about dementia-friendly library opportunities and their ambassador program. So please feel free to unmute yourself and ask the questions. This is also a time that you can share with one another any best practices, any strategies that you're currently doing, or just talk about anything you want to talk about. This is a very organic discussion. So we might start off with a topic, but we might veer to other topics as we go along. So welcome and thank you for joining us. So first question, I'll start with a question. Does anyone in our audience have any strategies that they're currently using for creating a dementia-friendly library? Or any questions or concerns that you have in approaching or serving that population? I see a hand is raised. Jason Rogers, you can feel free to come off mute or post in the chat.
Hi, this is Jason Rogers from Tampa Hillsborough County Public Libraries, and we are starting to create environmentally friendly bags that include things like a face cover to cover their eyes if they get overstimulated, sunglasses in case they want to still see but they need to dim the lights, headphones that they can keep to like lower the sound, and then also just like different things like plastic rubbing stones to like help them keep them busy, pop like little hand popper plastic. I don't know what those are called. I call it a poppet, but just small things, and then like something that will wind and unwind, like the little plastic chains. So we're just putting all of those in a bag, and then we're offering them to customers as they walk in and we see there might be a need. We walk up and say, it seems like you're having a rough day. If anything in this bag it can be of use, great, feel free to use it. If not, that's okay. Just drop it back off at the front desk. I hope you have a great day. If we can help you, let us know.
That is so awesome, Jason.
No, that's amazing. But I also don't know if that is 100% applicable for persons living with dementia. They might not quite understand why that is being given to them. It's not as like common of a automatic response as it might be for persons living, on the autism spectrum that like are easily overstimulated. It does happen with persons with dementia, but they might not really, they might need more direction and explanation about why they're given the things that are in the bag. So I think that's important to think about, is someone to really walk through what's in there and what it could help them with. Um, I don't know if just handing someone a bag that is living with dementia and is already kind of confused about what's going on or maybe overstimulated, that would be enough. Just my thoughts upon hearing that. But it's a beautiful project and just way to help people feel more comfortable in the library setting. I just think they might need a little more support to use those tools.
I also just want to add, I love the idea of an environmental bag. I think what can happen in a setting that, maybe someone with dementia wandered into, right? Like a library, because they're like within our community, is they might not really understand, to Nicolette's point, a bag is just given to them. Now, I like the way you present it, right? You're not really, you're not making them feel out of ordinary, right? You're saying, hey, here's a bag just in case you want it, right? Sometimes what can happen is if you're noticing something's a little underneath the surface with someone living with disease like dementia, when you approach them, they might jump, right? Because you're just like, oh, okay, someone's talking to me. So really, if you're noticing that, maybe bring them to a quieter space on the library. So if there's a whole bunch of people within a certain section, and there's another side of the library that's a bit more quieter with less people, maybe walk with them, always have the hand, right? You always be like, oh, hey, how you doing? Right? Because that's the automatic response that they're used to, right? Whenever we meet someone, they always give us their hand, right? Just to say like hello and hi. So then you can walk them to the side, very subtle. They don't feel like they're being like punished or, pointed out in the crowd. And then you can talk to them about the bag, like, oh, hey, we have, as part of our initiative with the library, we're handing these out to the community. We have headphones, they go on like this. Here's some songs that we have. If you're playing like music from the 70s or 80s, that's a little bit more resonating with that population. But I love the idea of the bag. I think that's a really nice way to make them feel incorporated without making them feel, different.
Thank you, Nicolette and Christian, for those best practices. Does anyone else in the audience have anything that they're doing at their library? Oh, I see Antoinette has put in a question. What tips can you offer with regard to hosting events to help caregivers as well as the seniors they care for?
Yeah, we've got some ideas for you. Thanks for being open to serving that population. Libraries are a great place to host events and education for family caregivers. In Florida, we have almost 900,000 people that are caring for individuals living with dementia and other chronic diseases. So it's extremely important that a lot of different sectors can come together to be a resource for them, and libraries are a great place for that. Some ideas it could be a place to hold an educational series more around educational series for family caregivers, understanding the nuances of taking care of somebody living with dementia or Alzheimer's, which is the most common type of dementia. It can be a place to offer education about the disease, about communication skills, care skills, partnering with community agencies so that they can share with that audience what's available to help them in this situation, what kind of resources and supports are available in your community. So kind of more of an educational approach for that population. I know some libraries are starting to incorporate a memory cafe event, which is not educational. It's a social opportunity. It's all about fun and connection and helping family caregivers and persons living with memory challenges for them to be included in a social space, to have fun, to interact with their peers, and to just enjoy themselves out into the community, because people can get very isolated when they're taking care of someone and they're stuck at home. So having an opportunity for more normalcy and more interaction with other people. So that would be a memory cafe. That's something that some libraries in Florida are hosting. And another opportunity would be more of like a class series or a even support group series that is maybe offered once a month for family caregivers to come together to share about what their, experiences in the caregiving role is like, support each other, learn from each other. Again, you could have guest speakers, you could just let it be more peer facilitated, safe place to share. But those are some ideas for reaching family caregivers. Library spaces are such a good forum for that. Did you have any other thoughts, Christian?
So for the memory cafes, I just want to expand on that. I know that in Manatee County, they're just starting to enroll or kind of give out or produce memory cafes in that area because currently there are none. And the way that we're doing it is we're first surveying the community, right? So that library has a bunch of different, events they do for other families, right? So for children, young adults and adults, right? So what we're doing is we're going to post surveys simply saying, hey, have you ever heard of a memory cafe? What do you know about dementia, right? How do you feel about brain health? So that way we can really get a sense for the community. Well, do they want this? Is there a need here that we're meeting, right? And then once we kind of get that, we're also asking what are some topics they like, right? So we can think of beaches, nature, food. A lot of people like food. So, there's ways to really sprinkle in very naturally. So you're not feeling as library organizers or operators that it's very kind of reinforced, like it feels like, oh, this isn't normal for us. There's a lot of natural ways to bring in and bring the conversation of dementia where it's non-confronting and it's very normal and non-medical in nature. The way I like to think about memory cafes, it's just a way to get people talking, right? In a way that feels normal. It doesn't feel like the dementia is not the focus. It's just to make them feel like they're an adult, right? So they're talking about their experiences at work, or if they're retired, what work was like. And it's very non-confrontational. There's really no, there's no wrong way to hold a memory cafe. And I think there's a lot of creativity there that can be had. So.
There was a follow-up question in the chat from Antoinette. How would you describe the contents of a good memory cafe? I'm not sure if that's related to like the structure or things you should provide during the cafe.
I could answer that if that's okay.
Go ahead.
When we think of a memory cafe, it is very non-formal, right? So we have a pre-registration. So there's typically 2 volunteers. The one volunteer is the actual facilitator with the group. And the group number is typically 5 to 8. It's very small, not a lot. Maybe, and it has to be one caregiver and one person with dementia, right? So they come in pairs. So it's not really meant for someone who might not have a caregiver. That doesn't mean you can't incorporate that, right? But traditionally, it's going to be a caregiver and a person with a disease, with the illness. And so typically the facilitator will have a theme. So for example, we could think the theme is Easter, right? So what were some Easter traditions? How do we like Easter chocolate? Or, what was what were some of the eggs that you would paint and what colors would you make the eggs, or where would you hide them for the kids in your community or for your own family? So that would really be it. That would be the natural flow. Obviously if someone, especially someone living with disease says something a little offhanded or kind of off topic, maybe about, we talk about bunnies, and from bunnies, they think of the zoo, right? Or from bunnies, they think of, farms, right? You just naturally kind of go with that conversation. You don't make them feel like, oh, that was weird. It's very natural. Food is not expensive. The food isn't really what's important anyway. So the caregivers and their loved ones aren't looking for it. Honestly, it might be some Panera or Publix like cookies, right? So it's really low cost, low effort. A water bottle, like a pack of water bottles. And that's really it, as long as you know what the caregivers and the loved ones are interested in, right? So that's why I recommend the survey. So they know kind of beforehand, like, oh, this is some things that they're interested in. But outside of that, really, there's no way to do this wrong. As long as you're open and willing to partake in it, I think your heart's in the right place.
Yeah, it's meant to be conversational, think of seasonal types of things, icebreaker type questions. And of course, just like meeting someone where they are in their reality. If the person gets a little bit, the person living with dementia might be thinking that they're a younger version of themselves or be getting a little confused about the topic. Like we just go along with it. That's part of our communication skills when we're interacting with someone with dementia. I think it'd be appropriate to incorporate some kind of craft or other activity. I just did an activity recently where we did like a doodle pass. So each person gets a piece of paper, you just start doodling, and then you pass it to the right. You start doodling, pass it to the right. And it's like a nice, easy way to see what other people are adding to your drawing or how kind of organic themes form. Like maybe something like that could be incorporated into the memory cafe. So kind of, but the main rule is it's not about talking about dementia and talking about Alzheimer's. It is just purely a social and recreational activity for these individuals.
Thank you for
Thank you.
sharing that. Oh, go
Thanks
ahead.
for questions,
I just wanted to
everybody.
say thank you so much. And also thank you, Monica, in the chat for the tips that what you are doing at Marion County. Thank you all. Great answers. Thanks for the tips.
And thank you. That's a nice segue, Antoinette. I was going to read what Monica posted at my branch location in Marion County. We have an ABCs of Dementia workshop for caretakers and those with dementia. It's a partnership that we have with the local organization, Coping with Dementia LLC. They provide information and resources during the workshop, and it's been very helpful. Does anyone else have any partnerships with their any community organizations that they want to share, or any other things that they're doing to support uh, dementia, those with dementia and their caregivers? I particularly like the Memory Cafe and your strategies for not only food, because I like food, but also the Doodle Pass. I'd like to do that myself. So that's awesome. Crafts is a great icebreaker and food.
Yeah, talking about key life milestones, things about the past can be a little more accessible for persons living with dementia. Talking about memories maybe from their high school days or you know things like that can be depending on the person's life, but sometimes easy conversational topics. Having perhaps like photos from a different time era and talking about this, having different objects from a different time era, asking people to reach into their purses and share what's an object that you have with you that's meaningful to you. A lot of times people will have pictures or some like a cross that their grandmother gave them or something like that that they carry around. So just kind of easy activities that can help people connect with one another. When we're talking about partnerships, I highly recommend finding out your region's memory disorder clinic. For those that are not aware of that, that is those are clinics under the umbrella of the Department of Elder Affairs. And if that clinic specifically doesn't have the capacity to partner with your library, they can help connect you to a more of a localized agency that can. But that would be a really good place to start, is to connect with your memory disorder clinic. And many of them will be open to partnering with you because that's a large part of the function of those clinics is to do outreach and education. So that's a great partnership for you to form for your region. I can put I'll put a link into the map so you can find where you are and what your clinic and their contact information is. I'll put that in the chat.
Thank you, Nicolette.
Sure.
And I wanted to add for the organizations, all counties in Florida, right? They're grouped within dementia care and cure initiatives, or otherwise known as DCCIs for those that may not know. And DCCIs are kind of grassroots groups, right? So these are professionals that work day in and day out with those with dementia. So these are those that put their money where their mouth is. You know, they wake up every day and they serve the community. So again, bring it back to Manatee County. The memory cafe that we're working together on start to roll out is we're having in-home care kind of organizers and companies that are sponsoring the event. So they're paying for the food. Again, it's less than $20. They're also willing to volunteer. So that way the staff from the library don't have to, if they're uncomfortable with maybe, getting their feet wet, just kind of facilitating on their first go, someone that actually is a professional can kind of guide them through that process, right? So they can feel a bit more comfortable. And then, if the library wants to take that over completely, they absolutely can. But if they want to, have volunteers from the community, from actual professionals, so they can feel trusted and assured that the meetings will go well, that these groups will be very meaningful for the community. That's one way that the connection between the DCCI and the library organizers are blending together.
Great. Thank you for sharing that, Christian. It's valuable information. Does anyone else have any questions related to this or to anything else as far as other best practices that you're currently doing or would like to know about? This might be a perfect segue to kind of talk about the ambassador program. Would you like to talk about that?
You're talking to me?
Yes. I'm
Um,
sorry.
I'm not sure what you're referring to.
The program where a library can connect with a person within the region, getting trained, the training, or maybe I'm calling it something different.
Yeah. Well, so we were available to help provide training to your staff. We like to promote dementia-friendly library opportunities with kind of three different main actions: training for staff, training for volunteers to better understand how persons live with dementia, their symptoms, what you might see in the library setting, how to respond, how to communicate. So trainings like for new hires or in services, that can be live, that can be in person, it can be handing out an educational brochure as part of your new hire packet. Whatever, as involved or as kind of minimal information sharing as you'd like to educate your teams. That's a big component. Another component would be the environment, making the environment accessible for persons living with dementia. And that would be covered in a training, kind of what ways can it be a little bit more inclusive for persons living with this condition, having some memory challenges, having some visuospatial challenges, needing a little bit more context and guidance to navigate a space safely. So how can that environment be inclusive and helpful so they can still continue to use the library? Also, what kind of resources should you all have for family caregivers and for persons living with dementia? What books should be available? What type of tools like memory kits or conversation kits or things that can help families better interact with their loved one living with dementia to just have a chance to connect socially. And for the persons living with dementia's engagement, intellectual stimulation, is it certain books for them, having audiobooks available, large print books, coffee table books, so resources for persons living with dementia and resources for family caregivers, books that are available for family caregivers to help them understand the nuances of this role. We've got some great recommendations for those audiences. Also here, I have a case of some books called the Family Caregiver Help Book. It's part of an evidence-based class for family caregivers to learn how to practice self-care as they care for another. And this is not just for persons caring for someone living with dementia, but family caregivers in general. So it's a very helpful book. really practical tips. So we have some of those if people are looking to expand their resource collection for targeting that population. Let me know. We'd be happy to send a couple copies to your location. But having those resources available, maybe having a plan in your yearly calendar to highlight brain health in June or spotlight family caregivers in November. So things like that can make your library a bit more inclusive for this population. And then the last piece would be what we talked about a little bit ago, like hosting events, hosting community education classes like a memory cafe or support groups for family caregivers. So those are kind of the main strategies that my team at the College of Medicine, in partnership with Department of Elder Affairs and the Dementia Care and Cure Initiative, we can do virtual training with you all. We can help connect you to local trainers to get this stuff going in your area.
Thank you.
Sure.
That's awesome. There's a question posted in the chat, and we look like we have some interest in the books that you were just talking about. How can a library connect with you if they have questions or interested in training?
I would say just email Christian and and we can figure out how to best meet your needs. So I can put our contact, or go ahead, Christian, and put yours in, and I'll put my info in the chat. And I will note if those of you that put in the chat that you'd like a book, if you could send me an email with the request and the address it should be sent to, that would be really helpful. And we will make that happen for y'all.
And I would like to let you all know that at the end of our discussion, we will send out an email with a copy of the chat log, so you will also have their information in writing as well. But thank you for your questions. These are awesome. Does anyone else have additional questions? Or would like to share any happenings in your library related to this topic? I have a follow-up question if no one has one. What challenges have anyone observed with this population when they do visit the library? Has anyone had any experiences with that? Antoinette, I see your hand is up. Feel free.
Hello? Oh, there I am. Okay.
There you go.
All right, I wasn't sure. Thank you. That was a great question. At the moment, at our Orange County Library System, we're a very large organization and we are focusing on community engagement, and I am with the Community Engagement Department. We are focusing right now on serving senior communities of, of all different backgrounds, active seniors, independent seniors, but we are really struggling a bit with just figuring out how to manage an outreach where we go somewhere and there's a variety of different stages of dementia that can happen. And some of our outreach specialists will sometimes share that they were not quite prepared to have such a variety, and they're not sure how to approach if somebody's combative, for example, or very negative. So basically, we are working on gathering as much training as we can, and we've gotten some wonderful training. But I am interested in learning more about what is included in your training, where staff overall within our branches and also with our outreach specialists can get some real hands-on training to talk about how to handle if somebody comes into the branch and is maybe confused and upset and combative. What are some tips that we can share with them or some resources that we can pursue?
You want to take that one first, Christian? You want me to?
Yeah, absolutely. I can
Go ahead.
start. So when I did a training, I trained the Pinellas County, I trained their librarians, and I also trained their Park and Recs team. And that was joint training. And what we did is we first kind of went along and discussed the different types of dementia, the communication strategies for dementia, right? And then we opened the floor to discuss kind of what did the community see, right? So what did those employees see? What were some of the experiences they had when someone, to your point, comes into the library or the Parks and Recs office and they're showing some disorientation, they're a bit confused. Maybe they're a bit, because they're confused, they're now combative, right? Because that's their natural way of expressing themselves because they might not have the vocabulary anymore just to say, hey, I don't know what's going on. I don't know where I am, right? So that might not be a natural inclination, for those living with disease like dementia. What we would do is we would talk to them about the steps, right? How to do a very nice care approach, right? So we don't approach someone from the back because that's very scary, especially with someone who's older, whose visual field might just be this. Not only that, but how do you actually introduce yourself, right? So, with a warm smile, right? With the hand out, right? Because we want contact. We don't want to make them feel like we don't want to touch them, that we don't want to put their, like a hand on the shoulder, that we're there to support them, that we're offering a very comforting environment. So those are the ways that the training can really help is that we do bring that material up in the, in our PowerPoint. And we do ask the audience to really share and talk about what do they see. We are not at all opposed to doing a demonstration where I would be someone, living with disease and having either a care attendant or library staff interact with me. That's something I do because I think it's fun. It really can showcase what is it like. We play around, but it's really just to showcase what is it like, what do you do, what does it sound like, what does it look like, so those are some of the things that we can do with the staff or that our training does encompass. So I'll hand it over to Nicolette. Yeah.
Yeah, thank you for that, Christian. Give an example of how this has been done with another group. We talk about the symptoms of dementia so people can understand what to look for because, yeah, it's not always obvious. And also, someone doesn't have to be older. People could have early onset, be in their 50s, and it's not obvious at all, but they have very severe short-term memory loss and other functional impairments. So we help people understand the symptoms and what to look for, and then offer those communication skills to try to connect with the person and try to encourage cooperation. That also includes some de-escalation strategies for when someone might be overwhelmed, overstimulated. We like to say that behaviors or challenges is just the result of an unmet need. So some like what's really going on with the person. So giving the, trainees or people in attendance tools to like do some detective work to best figure out how to help someone or to at least help try to build trust and reduce that feeling of overstimulation with them. Hopefully that answered your question.
Yes, thank you very much. That sounds wonderful. I wonder also, it's great to have the in-person training sessions if that's possible, but we also like to have resources that we keep in our sum total so folks can go back and get a refresher course, or if we have new employees come. Do you offer anything like that where we can have like an in-person training, then maybe something videos or something that like an online training that we can have for employees and our outreach specialists who are actually going out there, especially to be able to go back and have a little refresher?
Yeah, I think if there's enough demand for it, it makes sense for us to create like a standalone training that can be viewed by different groups and incorporated into your online learning platforms or on your intranet or wherever those kind of resources live. That's something we could definitely work on. There's also a lot of good stuff out there. It's more for it's like targeting family caregivers, but a lot of it is very applicable for other types of professionals interacting with someone. I will give a shout out to the UCLA, their UCLA caregiver training videos. They offer just such great approaches on how to interact with persons living with dementia. So I'm thinking we could probably put together recorded training and like some links to existing resources for this type of stuff for y'all.
That would be wonderful. Thank you so much.
I do want to give a plug for our, we sent out a couple weeks ago a request to all the library directors in the state to complete a survey. We would love to hear from you all. If that's not who's on the line right now, which forgive me for not asking at the top who our audience was specifically, because y'all have such big staffs within the division and local libraries. But we put an ask out for folks to complete this dementia-friendly library opportunities survey, and that would be a really good chance to submit your questions, submit what you're already doing, because we're going to create a resource guide for all the libraries in the state of Florida that will include this type of information. And we can really be more specific about what you're looking for if you complete that survey. That would help us out a lot. I'll put that in the chat too while I have you all here.
I have a question. Will this also be applicable to patrons that may have also Parkinson's? Because I know that I have received several calls from like caregivers or family members because their loved ones are losing their literacy, their ability to read. And not only that, adults that are struggling with aphasia and are like recovering stroke victims that has affected their short-term memory as well.
Yes, I definitely think that this falls under that umbrella. Dementia is an umbrella term. It's basically a term that describes changes in the brain that lead to challenges with memory, thinking skills, judgment, language skills. So there's a bunch of different types of dementia. For some people, Parkinson's does lead to those types of symptoms. And then also people that have had strokes, can often lead to vascular dementia. So absolutely this falls under that umbrella. But those are more specific things that you're looking for. So it's great that you shared that. We could try to include it in the resource guide. I think I saw a question in the chat about audiobooks for people with dementia. I think it really depends on the person, but I would say to recommend things that are like shorter stories, more simple type of content for that would help folks that have a reduced attention span. That could be a good option.
And I did want to add that when we think of the specific content for those living with disease like dementia, I know often, when I hear from my caregivers I work with, if they're like children, right? And I want to stress to really be very cautious about that comparison between those living with dementia and children. Children have the ability to learn, people with dementia really do. Not only that, but someone with dementia as a full-grown adult, they have experiences much like you and I, right? So they've lived through it. They don't need to read a children's book. So really be very cautious about the materials you share with those caregivers and those living with dementia. Make sure that their audience is not for children. Because while it seems kind of, that they're symptomatically, right, especially as they advance now, they're starting to look like kids, in their behaviors, they're very much not. So I just really want to stress that point because my caregivers that come to me sometimes say things like that, and I have to quickly pause and have to educate. So just want to make sure that's known.
Thank you, Christian. A couple of things. One, There's a great website called News in Levels, and it's like levels 1, 2, 3, and it's like all the latest news, current events, but in like basic, intermediate, and advanced adult learner levels. And it has the ability to read the compressed, and it'll read the article to you. Um, I think that would be great. And also, maybe like the adult learner books that are like called quick reads. Some of them do have audiobooks. Some of them are like less than 100 pages, and are adult themed that, are not very complicated in vocabulary and sentence structure.
I love those recommendations, those ideas, honestly. Thank you so much. I'm gonna share that with my families. I'm gonna share that with them.
Yeah, thanks.
Oh,
Are there,
and
go ahead.
sorry.
No, you
I just wanted to give you a plug because if you don't have them in your collection, you can borrow them from the Florida State Library.
Thank you, Shanice. We'll accept that plug. Does anyone have any additional questions or thoughts? Thank you, Christina. This has been a great and informative conversation. I'm learning a lot. See some posting in the chat. Another one. Thank you for sharing many helpful resources. Thank you, Deborah.
I just put our link to our survey in the chat. I would really, really appreciate it if anyone could take the couple minutes to complete that, and it would help us learn about what you're doing and what things that you're looking for, what gaps you're looking to fill, and how we can help provide those resources.
Thank you, Nicolette.
Yeah,
And,
thank you all.
and thank you, Shanice, for putting that link that you were referring to. While we have our experts here, does anyone have any more questions or comments they would like to ask?
I want to share just super quick. I think I'm really grateful, right, that you guys are showing an interest for caring, really just caring about people, not only living with dementia, but their caregivers. There is such a strong stigma about this illness. And I've talked to many of my caregivers who are so afraid of going outdoors because they don't know if their loved ones are going to be in a safe space. If there will be someone who's going to look at them strangely or kind of side eye the caregiver as a bad person because they can't handle or manage the loved one having just a behavioral outburst, or just saying something strange, or doing weird things, because that can happen. I want you to know that it's really important doing something like this, that my families always seek just a safe space that they can be out of the home, because that in of itself can be such a huge relief for them, that they're not cooped up all day, that they're allowed to, even if it's reading a book, right? Maybe not my favorite activity when I have my days off, but just being able to be out of that environment, to talk to another person, about a topic that's not just their loved one or their illness that they're going through, but to say like, oh, this was such a good read, or oh, I never even thought of something like this. This is, really engaging. Those are the things that my caregivers are really looking for, is just to have an outlet, of support, and just to be with those that are maybe going through something similar. So thank you guys so much for caring.
Thank you for sharing that. I would have to say it's a shameless plug for librarians. I'm a librarian myself, so it's like, that is the business. We're in the helping business, and we love to connect with our community to better serve our patrons and make sure that our services are user friendly for everybody. So I appreciate both you and Nicolette for sharing your expertise. So if we have a little under 15 minutes, well, 14 minutes now left in our discussion. If you have any more questions, please feel free to share. If you have any topics that you would like for us to focus on in future DLIS discussions, please share that as well. This is a peer learning environment, so we want to make sure that we are offering topics that you need the most, that you want answers to, that you are showcasing the great work you do in your libraries and the programs that you offer. So please feel free to share that if you would like. We will have a survey later on posted in the chat that you can also share your thoughts and comments. But please feel free in this environment to share what you have in real time. Always open to hearing your feedback.
I don't know if it's okay for me to ask, but I did want to ask the group if anyone was personally or has been personally affected by the disease, if they've ever known someone who's lived with it, if that's something, that, is kind of precipitating your involvement in a program like this. I think it's always good to hear stories because I think dementia is much more widespread than we like to think it is. And it's very common for not, if it's not within our family, but maybe our neighbors are going through something like this. And then, just being able to offer that support. Oh, thank you for sharing, Catherine. Yeah.
Thank you all for sharing your personal stories and experiences with it. It really does affect all of us at some point by maybe very closely related or to some degree of separation, but we can all learn how to better interact and how to support those that are in the thick of it. And sorry for your losses, and thank you for all the care you likely provided to your loved ones during that time. I see a question about what is the best strategy to get started with this type of program? A program just for caregivers or one for caregivers and the family members? It really just depends. I think it's probably more common to host educational events targeting family caregivers. And that can help you establish a network and establish yourself as like a resource hub and a safe place, as Christian said, for this population. And once there's, decent attendance and a decent group of people that are connected and interested, then perhaps starting the memory cafe. But probably an easier first step would be hosting some educational presentations for community members. But that's a really good question. And let us know how we can help you get started. Antoinette?
Yes, I wanted to kind of talk a little bit about that because personally, my mother had suffered from dementia. She did not have Alzheimer's, she had dementia, and my father was her caregiver for the most part. And it was always very important for him to be able to take care of his own mental brain health. And so it was hard for him to get that time away where he could play chess or do something that helped him. So I think one of the goals that I personally have would like to see our library do is be able to create a workshop of some kind or an event that is social, but that there's a way that if someone comes who is the caregiver and they are bringing their spouse or loved one or whoever it is that they are caring for that has dementia, that there's a way that they can have something that is for them. I'm not sure how that would work. So I am interested if anybody's ever done that kind of workshop where people would come and both the caregiver and the senior with dementia are served, where that caregiver has the opportunity to maybe be there, but not be completely responsible for
Mm-hmm.
the focus being on the person with dementia, I guess is what
Yeah.
I'm saying. How do you share that focus in a
So
workshop
you
like that?
so you would need to set up some kind of respite um or social group care for the persons living with dementia. So there was someone with the expertise of interacting with those individuals for leading activities for those individuals. And I would think it would be in a separate space so that the caregivers can get their chance to have a little break, to have an opportunity to connect with others that are in their situation or get education. But like you're saying, they're responsible for their loved one. They have to bring them with them. So that would be like a respite care provided on site during the event. So that'd be a little bit more complicated, but would probably help you get more family caregivers there. And then you're providing an activity for persons living with dementia too. So, and that's a really amazing idea. But I would think that's how you approach it. When we've had some family caregiver conferences up here in Tallahassee, that's how we approach it. There's respite care provided on site, and it's like a social group for persons living with dementia that are safe and taken care of in a separate space than where the family caregiver education is going on.
Can I interject something?
Mm-hmm.
So I refer um, patrons and tutors that I work with. Um, the University of Miami has several support programs for caregivers. And so they do provide respite care as well. So I would suggest maybe partnering with your local hospital or university. They may already have a support group and just seeing how you can partner. I don't work with them, but I do um, coordinate with the young lady that runs the program, Dr. something, I can't remember her name at this moment, but and I just do referrals to that program.
That sounds great. We do actually have some adult daycare organizations, and some of them are faith-based, private, and that might be possible that we could maybe partner with a local organization that provides respite care or adult daycare. It's kind of rare. We're finding these days that there are great facilities. We have, oh my gosh, I think over 60 of them in our area that facilitate memory care. But as far as having people who are dealing with it on their own privately at home, sometimes they will reach out to their faith-based organizations and they're providing it. So that's a great tip. Thank you so much.
This has been super awesome. I want to acknowledge Catherine's question. I'm not familiar with this organization, but she's asked, has anybody worked with daughterhood.org?
I have not. Interested to check it out though, and we sign off here.
Neither have I, but I'm gonna look it up. Okay.
But we have 5 more minutes left into our discussion. If you have any more questions or comments you'd like to share or practices, please feel free, or I can give you 5 minutes back to your day. Also like to have our survey reposted. It was up a ways, but just so you have it towards the end, feel free to complete that as soon as you're able. Be really great. Thank you so much for joining us, Monica. Thank you, Rebecca, for posting the post-BLD webinar survey. Thank you, Catherine. Thank you for everyone who also shared their experiences with your family members or loved ones with dementia. Does anyone have anything going on in their libraries they want to share out before we go? Thank you, Shanice and Antoinette. Nicolette or Christian, do you have any, things you would like to share as we end our discussion?
I just request, I hate to ask y'all to complete another survey, but if you could fill ours out, we would appreciate it. I saw some emails coming in requesting those caregiver help books. Save Christian and I's contact too for when you have trainings. We could do them live. Christian, you're down in like kind of in the Tampa area?
Yeah, so I live in Spring Hill, so if you ever are in like Hernando, that would be great. But I can drive, so never hesitate if on that side of the earth you would like a training.
Yeah, and I'm in the Tallahassee area. But often do things like in the whole Big Bend region. Or again, we will just connect you to our colleagues that are local to you for in-person training, and we can always do these type of Zoom live webinars. So yeah, we just are so excited to continue to work with libraries, and let's keep it up.
Awesome. And thank you so much, Nicolette and Christian, for joining us and answering those questions. We appreciate your expertise and your time. This has been great.
Thank
A
you for having me.
pleasure.
And before we go, I want to let you know the topic of our next DLIS discussion for May will be on May 19th at the same time, 3 o'clock. Libraries and community leadership. We will have leaders from Marion County Public Library sharing their expertise. So thank you so much. We will post that link into the chat, or you can go to our website and connect with us on there to also register for that DLIS discussion. Thank you so much, everybody, for joining us, and have a wonderful rest of your day. Appreciate you.